A record number of Americans getting sick with bird flu, millions of birds sick or culled in the US, egg prices skyrocketing and spillovers, almost 1,000 dairy herds infected, and one person dead. It's been hard to keep up, but bird flu is at a dangerous point, and the epicenter at the moment is the United States. Here are 4 things you need to keep an eye on as birds start flying north for migration season. Number 1, watch how the virus is mutating. Bird flu is still very rare in humans, but the risk level would change dramatically if the virus were to become more transmissible from person to person. And scientists think H5N1, specifically the type spreading in cows right now, is just one mutation away from making that jump. And that could spark a pandemic. Nobody wants that again. But every infection is an opportunity for the virus to mutate. And this virus really likes being unpredictable.
It can change its genetic structure in a matter of days, if not even hours. It respects no borders, doesn't require a passport.
And it's getting a lot of opportunity to mutate. Everything from cats, dogs, sea lions, and sheep after mingling with wild birds or eating raw pet food. At this lab, scientists have been testing Canadian birds all through the winter.
How often do you test for H5N1 here?
So over the past few months, we've been testing it every single day.
And they're bracing for a whole lot more.
And now that the birds are coming back north for the migration, we don't really know what's coming.
The strain of bird flu circulating in wild birds and poultry has been deadly in humans. A Louisiana senior died after being infected with that strain in January. In November, the same strain put a BC teenager in hospital for 2 months.
We do not want that virus to adapt to humans. So we all have a responsibility to shut that down.
That's why BC shared data about their case, like genomic sequencing, widely.
To ensure that researchers worldwide would be able to interrogate that virus, find its weak spots, and find how we need to adapt, adjust, make sure that we are doing what we need to contain it.
That's why it's crucial that scientists around the world share data quickly as the situation evolves. Which brings us to Number 2, watch how well the US cooperates with other countries and the World Health Organization when it comes to bird flu. We depend on the US to curb the spread of bird flu. Because birds fly between our 2 countries, we work with each other to monitor flyways. We tell each other about mutations of concern, and we tell each other about the locations of infected animals.
There is a substantial amount of disease threat and change going on in the US itself right now. And the ability to track and monitor these things and understand them really depends on that goodwill to be open and proactively engaged in the international arena.
But it's a volatile time for American scientists and for America's role in global health. There have been funding and job cuts at key agencies like the National Institutes of Health. The Trump administration also accidentally fired employees tied to bird flu response as part of Elon Musk's sweeping purge of the federal workforce. Now they're scrambling to hire them back. Plus, there's this.
What is this one? Withdrawing from the World Health Organization, sir?
Ooh, that's a big one.
In the past, it was a given. If a dangerous pathogen pops up anywhere in the world, the US would act quickly to get the latest information about it and share it with others at the WHO, part of a global effort to curb the spread. But now,
by pulling out of WHO, we will begin to lose that ability.
The good news, the US has been picking up our calls on bird flu so far.
We have had actual reporting from the United States. So when they have a human case, for example, we are getting the information from them.
And there are multiple sources of information. American academics, top players in their field, are still talking to colleagues around the world, as are some American states with provincial counterparts. The hope is that whatever happens with the Trump administration, those experts will continue talking. Number 3, watch how hard Canadian poultry farms are getting hit. The virus has decimated huge flocks of chickens in the US. The fear is that it'll do that here in Canada too.
As soon as you have 1 or 2 chickens or hens becoming infected and showing clinical signs, and then they're tested positive, then the entire flock would have to be depopulated.
One of the most noticeable ways bird flu is hitting Americans, the price of eggs, which have ballooned up to $10 a dozen in some cities. But here in Canada, we have supply management, and our industry operates differently.
We have a lot of farms with small number of birds in them.
And so the repercussions might look different. American egg farmers have been imploring their Department of Agriculture to let them use a vaccine to protect laying hens, but the US hasn't. They're worried it could disrupt export. France did start vaccinating ducks in 2023. Producers there say it's helped the industry bounce back. If the virus hits Canadian poultry farms as hard as it's been hitting American poultry farms, we might have to consider similar measures. And finally, number 4, watch for more signs that Canada is bracing for bird flu infections in humans. In February, Canada bought a store of H5N1 vaccines, and scientists at the BC Centre for Disease Control are working on developing wastewater and antibody tests.
It's a matter of when, not so much if, when avian influenza will affect humans and potentially with transmission. And so our job, our goal is to be able to track it, make sure that we understand when it's in our environment, and also be able to understand when it affects humans.
It's hard to track transmissions, and we still don't know where that BC teen got infected.
It's so important for us to have that awareness, to have the ability to do the rapid testing, to have the whole genome sequencing that helps us connect the dots of where these viruses come from and who's getting infected and how it's spreading from place to place.